Welcome to the official grand opening of the Ottawa Integrative Cancer Centre, first of its kind in Eastern Canada. So much can be done to help improve the quality of life for people living with cancer. We welcome patients at any stage and those wishing to prevent cancer or its recurrence. And we work with patients and physicians to provide therapeutic programs that decrease side effects and promote health during and after conventional treatment. Complementary care practitioners do treat the whole person and touch on what is often not considered in a hospital setting. Our therapies are not alternative, and we do not provide a substitute for care for conventional care. We seek to provide integrated care where patients share and discuss options with their physicians and where collaboration is the norm. A real strength of the OICC is the fact that we are a not-for-profit regional centre of the Canadian College of Naturopathic Medicine, and we do offer subsidized care.
The Canadian College of Naturopathic Medicine, through the Ottawa Integrative Cancer Centre, is committed to improving the lives of individuals with cancer. Locally, we will achieve this through the vision of whole person care, integrating the skills of a broad range of medical practitioners. Internationally, we will achieve this through rigorous research, documenting the outcomes for the patients we have served. CCNM does not believe that integrative care is a silver bullet that cures cancers. Most cancer researchers are convinced that no such single silver bullet exists. We believe, and we have seen, that this form of integrative care can substantially improve the quality of life for individuals with cancer and can enhance their survivorship ratio.
I'm a medical oncologist and have been a medical oncologist for about 30 years here in Ottawa. I think this is really something that is been greatly anticipated, not just by naturopaths or by practitioners of complementary medicine, but by patients, by researchers, and guess what, traditional medical practitioners as well. We really want to get back to understanding the person and all of the insecurities and the hopes and aspirations that patients with cancer carry with them. I think that we do a great job in traditional medicine about looking after the cell, but I think there has been an inherent problem with looking after the person, and I think this is one great way of building that bridge.
And I'm a 2010 graduate from the Canadian College of Naturopathic Medicine, and I'm also a silver Olympic medalist. Don't ask me how I got through it. And 18 months out of the Olympic final, my mother was diagnosed with stage 3 colon cancer. So it was a lot of emotions, and my mother and I had a pact. I would go to the Olympics and achieve my dream, and she would be in the stands to watch me. And it's through a center like this, an integrative cancer center that's in BC, where she worked with the doctors. It was a great system. She felt better going through chemo than she did before, just with all the lifestyle changes she made. So I really attribute the success with what you guys do.
The positive impact that OICC practitioners have on improving the quality of life of those touched by cancer cannot be overstated. It's evident from everything I've heard that OICC staff are professional, compassionate, and dedicated people who've come together under one roof to unite the naturopathic cancer care with traditional cancer treatments. The OICC works with patients, their families, oncologists, surgeons, and other health professionals to break down communication barriers and replace them with dialogue. Its forward-looking research pillar should also be commended. Research into new therapies and natural health products provides reliable, science-based information to both patients and the broader cancer community. I congratulate the Centre for its excellent work and hope to see this model of care replicated in other cities across Canada. I'm confident that here in Ottawa, this newly expanded facility will help improve the quality of life of even more cancer patients who are walking along the road to better health and recovery.
In our system of healthcare, we need the incubators. That's how we got the system we have to date. So this is an incubator. This is showing how it can be done and building on what we've done before, and that is to innovate. So this is wonderful. I'm so proud that it's here in Ottawa Centre, but I'm so proud that this is something we're doing in healthcare to support those who have to go down that walk of healthcare, and that we talk about prevention. It's so important.
Going through cancer care is tough, whatever way you cut it. But there are clearly benefits to straddling mainstream medicine and complementary care. I was very fortunate. You just met my oncologist, Dr. Shail Verma, who was open to my work with a naturopathic oncologist, and they were able to have a conversation and to work out a protocol for me to do, for example, intravenous vitamin C during my second chemo drug. The value of complementary care is enormous, both in terms of fighting the cancer and supporting the immune system, as well as diminishing the side effects of particularly chemo.
Over 10 years ago, when I lost my wife to breast cancer, with the Integrative Cancer Center, she would have been a million times better off. Whether the survival would have been in the cards, I don't know. But I know that managing, she would have been 100 times better off with this. This is a great thing. It is a great thing. But applauding from the sidelines is not enough. For this Integrative Cancer Center to really work, we have to work too. We as a community have to make sure that the message gets out. We have to make sure as a community that we do what we can to strengthen this place, whether it be through volunteering, whether it's through financial contributions, through getting the message out, whatever it may be. The integrative medicine is not only bringing together all of the dimensions of cancer care, but it's also bringing together the entire community. It's bringing together people that were, let's say, in different silos and saying, you know what, guys and gals, we're in this together. There's a strength in us all being together in this. And the Integrative Center is really an inspiration to say there got to be no barriers between us. There have to be no fences. We're all working together for the same common cause.
Like Tamara, I'm a breast cancer survivor. The OICC is helping me to heal, not just physically, but my mind and spirit as well. They understand what you are going through, the worry, the fear, the pain, the side effects. They help empower you to gain some control over what is happening to you at a time when it all seems out of control. I am a big believer in complementary therapy together with conventional therapy to provide the best possible care for cancer patients. I am so grateful we have the OICC. I can tell you firsthand that complementary care really does make a difference in the lives of people living with cancer.
Care for the body, care for the mind, care for the spirit is what you'll find. A special approach is what you need. With an open heart.